Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Monday, September 28th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and here for questions is Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. First up today is Dr. de Villa. Doctor?
Thank you, Brad, and good afternoon, everyone. As of today, I'm reporting 381 new COVID-19 infections. This brings our COVID-19 case count to 19,033. A total of 16,034 people have recovered from this virus. So far this month, there have been approximately 3,000 confirmed COVID-19 infections in our city. It's plain to see that there is an immediate rising risk in Toronto of continued and significant COVID-19 resurgence. Nowhere in the city escapes the risk. We move around too much for that. But this is not the time to panic. It is the time to act. As announced, over the past weekend, my team at Toronto Public Health served orders closing 3 restaurants and bars based on evidence that they had not acted as required by regulation. Orders were also issued to other businesses, instructing them to better comply with our contact tracing efforts. Also, over the weekend, new rules from the province took effect for the hospitality industry. These are important steps by the province. They reduce the ability of the virus to spread. That is the key. There is nothing inherently wrong with the hospitality sector. There is, however, a potential level of risk distinct to it, which the province acted to address. From my perspective, I see logical next steps specific to Toronto. As a large, dense, and mobile city, and particularly as a population center for young people, Toronto is seeing sustained increases in infections. I believe we can build on the provincial action so the city can further arrest the spread of COVID-19. In this respect, I will make recommendations to City Council at their meeting this Wednesday. These recommendations will include reducing the total number of patrons in any one bar or restaurant venue from 100 to 75, requiring these venues to collect contact information for each patron at a table, reducing the number of people at a table from 10 to 6, requiring that background noise like music is no louder than normal conversation, and extending existing bylaws created to govern the city during the pandemic until Council's first meeting in 2021. As your medical officer of health, I am acting to implement new actions as swiftly as possible that reflect the seriousness of the infection levels we are seeing. Where I can act under my own authority, I will. Where the participation of senior levels of government is required or will assist, I will work to secure it. You can count on me to do all that I can. And I will update you in this respect in the coming days. During the course of the weekend, we received inquiries from reporters about the safety of bars and restaurants and whether or not we recommend that people go there. This allows me to revisit a particular concern of mine relating to how people think about COVID-19. I want to be very clear on this point. because I have said before and feel compelled to say it again. I don't want people to have a false sense of security that if they just avoid one place or kind of place, that another is safer. COVID-19 is linked to a wide range of locations. In the past few weeks, we've seen COVID-19 linked to locations like private parties, a diverse range of workplaces, weddings, and religious services. I understand the belief that if we just list all the locations where infected people have been, it will tell us where we can go safely. But it doesn't work that way. Even if we announced locations in real time, my team cannot establish the facts of a case until we're notified of a confirmed lab result. Remember, COVID-19 comes on gradually, and sometimes symptoms never show up at all. By the time a venue is named publicly, the immediate threat has likely been over for many days. That person or persons are circulating in the community, not fixed in one place. Is there evidence that bars and restaurants, settings like these, can contribute to spread? Yes, obviously, as indicated by the actions we took this weekend. If a venue isn't following the requirements expected of them in order to reopen and operate safely, higher risk results. If a venue is consistently doing the things they should be to operate safely, the risk is lower. But there will still be risk. So truly, the most important thing to know is that you get COVID-19 from people, not from places. And in a big city like ours, people are everywhere. In that respect, in Toronto, we have to acknowledge that the extent of the infection spread and the nature of city life means that the concept of the bubble or the social circle no longer reflects the circumstances in which we live. It was a sensible approach to exiting the strict isolation and restrictions of last spring. It was an effective model for safely establishing contact between people at that time. But with reopening and the return to school, times have changed. And that is what you need to think about before you make a decision to go anywhere. Where you go in the city is less important than what you do when you are there. The decisions you make as you go about your activities are in many ways the most important way to fight COVID-19. The results we want won't come from rules that aren't followed. There's no way around it. That is why fighting COVID-19 demands we limit contact with people we don't live with and watch our distance when we're with them. Why we need to stay at least 6 feet away from people we don't live with. Why mask wearing makes a difference. Why washing your hands makes a difference. We live in a world where there's an app for everything. So it may be hard to imagine that such simple tactics can effectively get in the way of this insidious virus that we can't see. But they can. I'll end by repeating what I said at the beginning of my remarks. There's an immediate rising risk in Toronto of continued and significant COVID-19 resurgence. Toronto Public Health is responding. Chief Pegg and the Emergency Operations Center here at the city, they're responding. What we need you to do is to think carefully about how to protect yourself as you go about your daily activities. By limiting contact with people you don't live with, by watching your distance, by wearing a mask and washing your hands, you act to protect yourselves, and by doing so, you protect others too. It really is a powerful defense against COVID-19. These circumstances aren't permanent, but they're real right now. By taking action, we can limit the damage. I'll now turn it over to Mayor Tory for his remarks.
Well, good afternoon, and Dr. de Villa, thank you for your steady professional leadership. You know, as the doctor has well told us, we saw today an alarming number of new cases of COVID-19 in the City of Toronto. And I know that people are scared. These were numbers that shocked me when I saw them this morning just because of the nature of the increase, and I share the concern that people have about this resurgence. Dr. de Villa has warned us in past weeks that we would see a resurgence, just as we have seen in other cities in Canada and around the world. And we are taking action now to address it. We're asking Toronto residents to recognize that the alarm bell is ringing and to take action now in their own lives that will help us to stop the spread of COVID-19 and flatten the curve again. And I know that we can face this challenge as a united city. How do I know? Because we have been through this before, earlier this year. And we showed then, as we will show now, that we can take this virus on and beat it back together. We're doing everything we can to stop the spread of COVID-19 in Toronto, while at the same time keeping our economy open and keeping our schools open, all done in line with public health advice. So it is in some respects more complicated than what we saw before, but these are things that are achievable if we work at it together. So that's why we took action last week on COVID-19 hotspots identified by Toronto Public Health, and why we supported the province, as we do today, in taking action to help reduce the spread of COVID-19 through reduced restaurant and bar hours, a measure which I have advocated on for some time and which has been put in place in many other jurisdictions both within Canada and around the world, specifically to stop virus spread. We continue to talk to the provincial government about the numbers and the cases we are seeing in our city and what further action is needed. I spoke to Premier Ford as recently as this morning. I've also asked Dr. de Villa to continue to speak, as she does, with her fellow medical officers of health and her provincial counterparts, so that they can determine together what further public health measures are necessary. Today, I met with the GTHA, Greater Toronto and Hamilton area mayors and chairs to discuss the resurgence and how best to protect our entire region. We, the 11 largest municipal governments across the Greater Toronto and Hamilton area, are committed to working with the provincial government and with our provincial health authorities and our local health authorities to reduce the spread of COVID-19 across this big region. Given that every public health action will have an impact on the businesses focused upon, the mayors and chairs will continue to advocate for financial support from the provincial and federal governments to support the businesses who are doing the right thing and complying with public health measures. I've spoken this afternoon to the Deputy Prime Minister and Minister of Finance, Chrystia Freeland, on the matter of support for the restaurant and hospitality industry. It was an extremely positive conversation, during which she encouraged me to remind people, including those in the restaurant and hospitality industry, of the following words contained in the recent speech from the throne. She specifically encouraged me to remind people of these words, and I quote, "To help ease the impact that science and evidence-based decisions can have on local businesses in the short term, The government will work to target additional financial support directly to businesses which have to temporarily shut down as a result of local public health decisions. The government also committed to introducing further support for industries that have been the hardest hit, including travel and tourism, hospitality, and cultural industries like the performing arts. She and her colleagues are working as we speak on such measures as a high priority, and I have assured her these initiatives will have my complete support. We all understand the paramount importance of maintaining public health, as a healthy economic requires healthy people. To that end, Dr. de Villa has recommended a number of measures she has outlined today that City Council can approve this week to protect the health of our city. I fully support these measures, and I will be working hard to persuade my colleagues to support them as well, though I don't think much persuasion will be required because they just plain make sense. They include strongly recommending that people limit interactions outside their home and wear a mask as much as possible. Extending for 6 months our mandatory mask bylaws that apply to public areas in businesses, like stores, and common areas in apartments and condos. Urging the provincial government through the Ministry of Labour to introduce mandatory mask policies inside workplaces where physical distancing isn't possible. We have seen too many people getting sick from interaction with their co-workers. Mandating restaurants to collect contact information for every person at a table, not just one person, so as to assist us all with contact tracing, and making some adjustments to capacity limits within some of those same establishments. All of these measures are based on the best public health advice that we can get right now. To try and put it at its plainest and its simplest, we are trying to beat this virus back by surgically and tactically reducing opportunities for virus spread without reverting to a more complete lockdown. Restrictions have been put in place to keep people healthy and alive without going back to a total shutdown we can't afford again. These restrictions are meant to keep schools open and to keep most businesses open, with a clearly stated recognition of the need for financial assistance to businesses who are being asked to sacrifice for the greater good. And again, to put it at its plainest and its simplest, and simplicity will help here, we should revert socially to something closer to what we experienced in the spring. Aside from interaction at work and school, where many precautions are in place, please try to stick with the people that you live with. Plain and simple really does work here. Wash your hands. Wear a mask wherever and whenever you can. Avoid close contact and crowd scenes. Physically distance yourself. Stay home if you're sick. Stick to your own household as much as you can. We have done this before, and now we have to do it again. And I know that this great city is more than up for it. Brad?
Thank you, Mayor Tory. We have a number of staff on the line who can answer specific questions for any reporters who have them, including Deputy Chief of Police Myron Demke, who's responsible for Specialized Operations Command. First question is to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Dr. de Villa, I'm just wondering if you could explain something to the average person looking at the numbers today with 381 cases reported. That's well past the highest number that we saw in April at 300, when we were under strict lockdown measures and you were saying to people to only go out when absolutely necessary. What is different?
So, Matt, there are a few things that are different. One, we actually understand a little bit more about virus transmission now. And you've heard me say this before, this is still a new virus, right? The virus was discovered and sequenced in January, and here we are in September. So still a relatively new virus to us, to science, and we are still learning. But we do know more now than we did before in respect of transmission. And as you've heard the mayor just speak, we know what it takes to actually control transmission and to reduce the spread of this virus in our city. We know exactly what kinds of measures that we need to take, what the self-protection measures are that allow us to balance out reopening, restoring activity in our city, while at the same time trying to control COVID-19 spread in our community as much as possible. So that's why we are focusing in that very strategic and very focused manner that the mayor spoke of to implement measures that control COVID-19, but that also allow us to have, many other aspects of the city continuing to function, because we know that the good health of this city is not just about COVID-19 control. It is about many, many other activities. It is about the economy. It is about people's livelihoods, and it is about the broader range of health issues that go beyond COVID-19 control. Hence, that's what's different between today and what we experienced a few months ago.
Okay, thank you. And to follow up, when it comes to the city's dashboard, looking at it today, virus spread is only at the yellow level. And I'm just wondering what needs to happen to see it hit the red level, or in the worst case scenario?
Well, we're monitoring the indicators within that particular category of indicators as we're monitoring all the indicators to understand and inform ourselves around what actions need to be taken. So that's something that I'm happy to take up with the team, the data team at Toronto Public Health. They're constantly monitoring the dashboard and adjusting the levels appropriately in accordance with what they see and what the situation demands.
Okay, thank you. We go next to Dave Woodward from Global News Radio. Go ahead, Dave.
Thank you. Mayor Tory, this week, Council is going to be debating a report looking into the feasibility of mandating the COVID alert app on all city-owned phones. Are you in favor of this idea? And what do you make of those who say that making it mandatory goes against the nature of the app's intended use?
Well, I'm sensitive to the fact that we've been trying to persuade people that it's in their own best interest and the best interest of their fellow citizens to adopt this app on a voluntary basis. But we're talking here about city phones that are paid for by the city, and the city is expending millions upon millions of dollars, not to mention all the effort that is being made to avert tragedy and bad health. And so I think it makes sense that something like that is a paid-for phone by the city, should carry this app. We have other rules in place about how people use those phones, and I think this would just be one more, which would be in the interest of public health. So I'm not really troubled by it because these are city phones as opposed to people's personal phones.
As follow-up, I spoke with former Privacy Commissioner Ann Kavukian about an hour ago, and she says if it is mandated, it only widens a trust deficit that there's already between the government and the people, and in the long term, it could prevent some people from downloading the app in the first place. Do you think that could be a concern?
No, I don't, actually, because I think most people would understand that when it's a city phone, we're going to try and make sure that all the people who are on our team have this app located or downloaded onto their phone, that it is going to be in the interest of public health, that it is a reasonable requirement somebody supplying and paying for the phone would impose. And it's not as if we promised at any particular stage of the game that we would not do this with respect to our employees, and I think most of them would be understanding. I would be surprised if most of them didn't already have the app downloaded on their personal phones anyway. This is something that simply tells you if you've been in contact with someone else who had COVID-19. I think a great many people, as evidenced by the millions who've signed up, would like to know that.
Okay, thank you. We go next to Mark McAllister from City News. Mark, go ahead, please.
Good afternoon, Dr. de Villa. If you could further one of the recommendations that you're coming forward with, the idea that music in establishments be no louder than conversation. Is there a specific reason for that?
Yes, so very briefly, the evidence that exists out there in respect of virus transmission suggests that, people having to lean in close to each other, the closer you are, the more likely there is the potential for infection, if it's there, to spread from one person to the next. Further, that risk of transmission is also heightened when one has to raise one's voice in order to speak. And with loud music or just a noisy environment, people tend to lean in and to speak more loudly, therefore increasing the risk of potential virus transmission. Hence the recommendation in the council report.
Thank you. A question to both of you. Obviously, and you're likely very aware, as most people are, of the sentiment out there that people are tired, are fed up. Many people just simply are protesting against wearing their masks. Aside from sitting here every day or almost every day and offering your messages, how best to combat that? And are you frustrated when you watch this? How frustrated are you?
So, let me start, and I suppose I'll let the mayor have his chance to say. I think what you've heard the mayor say and what you'll hear me say is, look, we've learned a lot about this virus, and we know what to do. We've beaten this virus once before, and I see no reason why we can't do it again. I've tried to be very clear that I understand that taking these actions, maintaining all the self-protective measures are, by the one hand, actually quite simple, but by the same token, I understand that people are tired. This is hard. But it is the best thing that we can do to continue these self-protection measures and to really think about what it is that we're doing, whether we need to engage in certain activities, whether they're things that we really need to do or whether they're things that we simply just want to do, until such time as we get better and more effective treatments and effective vaccines. It is temporary. It is not permanent. I think we have reason to believe that there is hope. So we ask that people hang on, that they engage in these relatively simple measures, recognizing that everyone is fatigued and that there is, a desire to get back to the way things were. And we will eventually get to a point where we can restore more of our activities, but we just have to exert more discipline around these self-protection measures until such time as we have those treatments and or vaccines available to us. And, I will truly look forward to that day when we can, once again, enjoy our city in a fashion that's more similar to the way we used to in the past.
I will just say, being honest, of course there's a level of frustration, but I'd rather focus maybe on the glass being 95% full, because the fact is, like every other aspect of government and policing and bylaw enforcement, most people are complying. Most people are doing what they should do, and today I think we've given further clarification to them on things that will be in the best interest of stopping virus spread. But as usual, whether you're talking about mask wearing on the TTC or whether you're talking about people not being in crowd scenes or businesses following the rules, there's a few who are not. And so I guess we're trying to expend our efforts now on, bringing those people to justice, as it were, so as to bring about compliance if we possibly can. But of course it's frustrating, only because first, the frustration is that we don't know everything about this, so we can't just snap our fingers and say, here's the solution. But secondly, there's a small group of people who are not complying. But I hope that the different measures we're undertaking will cause them to understand that it is better for them to comply and that everybody else will keep doing so. And I know that we've proven in the spring we can improve these numbers, and we'll do it again.
Okay, thanks. We go next to David Ryder from the Toronto Star. Dave, go ahead, please.
Hi there. I guess my first question is about masks. I just want to understand, at one point it sounded like Toronto was going to, on its own, mandate masks in the workplace, and now it sounds like we're just urging the Labour Ministry to do something. Does that mean that our lawyers or policy people said the city can't do anything on its own?
So Dave, as I mentioned in my remarks, where there is authority for me to act, where I have that latitude to act, I will. And there are certain areas that are simply outside of my purview. It is a little more complicated. I won't get into all the details, but suffice it to say that when it comes to workplaces, the overriding authority rests with the Ministry of Labour as occupational health issues are within their bailiwick. Certainly we have latitude to discuss and engage in important discussions with our provincial counterparts, Ministry of Labour being just one of them. So I can assure you we are actively pursuing that route of action, as we know that having good conversation with our provincial partners is key to combating COVID-19 successfully in all the many different venues that are available to us.
Okay. My follow-up question is, there's some talk provincially, and I'm not sure if it's the same with the city, that the proportion of young people who are driving the surge is going down, and maybe the age range is getting older, which is obviously a concern when we talk about older people. Can you tell me if you're seeing that locally and if that's a concern for you?
So at this point in time, the most recent data that I've seen suggests that we're still seeing that shift towards the younger demographic. But like all the other indicators that we're following, we're constantly monitoring, not just the demographics, but every other aspect as indicated on our monitoring dashboard. It is very important that we continue to inform our actions on our local data and on the best available evidence. That's what we've done in the past, and you can count on us to continue to do that on the go forward.
Okay, thank you. We go next to Ashley Legasic from News Talk 1010. Go ahead, Ashley.
Sorry, I thought I was on mute. I apologize. Thank you for taking my question. Good afternoon, everyone. Dr. de Villa, I know I asked about this last week just briefly, but considering the numbers we're consistently seeing now, what specifically does a Toronto rollback look like? Will we see more of these recommendations soon? And do you agree with the Ontario Hospital Association that we should move back to stage 2?
So a couple of things, Ashley. As you've seen, we've taken some very clear and direct action in the last couple of days, as have our provincial partners. And as I've mentioned in my remarks today, where there is the necessity for me to exercise authority that I have as the medical officer of health, I have every intention of using those authorities in concert with the data, so informed by our local data and circumstances, and as well by applying the best available scientific evidence. In those areas where we require the assistance of other levels of government, or where the action is required itself from other levels of government, I will do everything in my power to have those conversations and to seek that assistance or action on the part of those other levels of government. We are all absolutely engaged and completely immersed in this fight against COVID-19, recognizing that this fight is about establishing a balance. We want to actually engage in appropriate COVID-19 control measures and at the same time ensure that the activities and the environment is such that we're optimizing health across the board, that it's not just about COVID-19. We recognize that there are many other elements that constitute good health in the city, and we have to balance all these things together. So that takes me to the Ontario Hospital Association, and I can appreciate where their concerns are. And in fact, I'm quite sympathetic and completely aligned with them. As you know, one of our major objectives throughout the entire COVID-19 response has been to ensure that the capacity for the healthcare system is preserved, either to respond to COVID-19 as a healthcare issue, or to respond to any other medical care issue that's required by the people of this province. So I completely agree with the Ontario Health Association that we must do what we can to preserve healthcare capacity in our province. It is about striking a balance between COVID-19 control and managing all the other aspects that actually give rise to health in our province. I think that it's important that we continue to engage in conversation with the province, with the OHA, with all the other stakeholders who have a hand in that. And I certainly commend the Ontario Hospital Association for speaking out.
Thank you. And today there's a lot of language like strongly recommend. Dr. de Villa, can you please clarify whether or not you're going to ask Council to approve the dissolution of social circles and how that would happen, how that would be enforced?
So, I'm not sure that it's actually within the purview of Council to dissolve or to advocate for social circles. I do think that what we are seeking from Council is their support in ensuring that we are messaging together, both within the public health realm and the politicians within the city who are concerned with the well-being and welfare of the city, that people are actually engaging in those self-protection measures that you've heard me speak about so often, and that we're doing the best we can to create the circumstances that help people to better adopt self-protection measures in their daily lives. I do think it's important that we have the support of council and that they echo the message that it is very, very important at this time for people to, as much as possible, limit their contact with people with whom they don't live. And when you have to go out, whether it's for work or for school, to maintain all those self-protection measures, limit contact with people that you don't live with. You know, watch your distance as much as possible. Wear your mask, particularly in those circumstances where it's very difficult to maintain that distance. And of course, wash your hands and stay home when you're ill. These are the kinds of messages that, you know, I'm looking for council to help us disseminate throughout our city so that we can engage properly in this fight against COVID-19.
Okay, thank you. Next, we go to Christina Tenalia from CP24. Christina, go ahead, please.
Hi, thank you so much, Mayor and Dr. de Villa. Dr. de Villa, I recognize you already addressed Ashley's question about the OHA's recommendation that Toronto and other regions return to stage 2. What I'm wondering is, what would be sort of the trigger that in which you would sit there and say, you know what, I support this. I think this is something we need to do now. Obviously, it's a provincial decision. Obviously, the city can make decisions under its jurisdiction. But at what point do you think, and Mayor Tory, do you think that the city's in a position where you would say, look, we need to revert back to stage 2?
So, Christina, again, very interesting question and a challenging one where we're trying to establish this balance. Again, I will say that, look, we've learned a lot over the course of the past several months. We know more about virus transmission than we did even just a few short months ago. So we actually are equipped with incredible knowledge to help us establish that balance, right? When we look at the health of the city, at this point in time, there's no doubt that COVID-19 control is clearly an important part of maintaining the health of the city. But it's also patently clear that the health of the city isn't exclusively limited to our concerns around COVID-19. We know that there are many other aspects to health, not the least of which is the ability for people to actually sustain livelihoods. So, to my mind, and to those in the realm of public health, the challenge is one of establishing the best balance between COVID-19 control measures and ensuring that people have access to the things that actually promote and sustain and maintain health. All the social determinants of health that you may have heard me speak about in the past, you know, jobs, the mental health concerns, connectedness to other people, and the list goes on. So this is a very challenging balance to strike, but it is one that we strike best when we look at our local data and premise decisions on our local data, and of course, when we apply the best available evidence, not only from our own experience, but from the experience of other jurisdictions who are a little ahead of us, particularly in the outbreak in the COVID-19 pandemic.
Christine,
And just same
I'd say
question
this.
for Mayor Tory. Mayor, I
Yeah.
recognize, yes. Oh, I just want to say, Mayor, I recognize you take your advice from Dr. de Villa, but are you getting to a point, or have you thought about this, going to Premier Ford saying, we need to take this a step back at some point? What's the timeline?
I don't want to speak for the Premier, but I can tell you when I speak to him, the two of us, without exception, are listening to the advice from our medical professionals. That's why they're there. And we have a dashboard in the case of Toronto that is very carefully constructed. And I suppose if it got to a stage where, you know, 3 of the 4 or 4 of the 4 elements were red and you wouldn't want to wait necessarily to get there, you would know you had to take some kind of a different approach. But again, that approach is going to be based on the best advice we can get from our experts and from the provincial experts. It is subject to the balancing act that was talked about by Dr. de Villa. She offers the advice, and I can assure you, myself and my colleagues try to find the best way in which we can implement that advice while at the same time taking into account some of these other considerations, including people's livelihood and jobs and businesses and so on. right now, I have something that I'm advocating on together with my fellow mayors about banquet halls, because I believe that there's an inconsistency on that step. And it's not a major thing in and of itself, but I think we take these things one at a time. We take the interventions one at a time. We base them always on the medical and health evidence given by our medical officers of health. And then we decide how to implement these in the most balanced way and effective way that we can. And that will continue.
Thank you. We go next to Kelly Grant from the Globe and Mail. Kelly, go ahead, please.
Hi, thanks for taking my question. This first one is for Dr. de Villa. In the most recent version of the neighborhood maps on the city's website, the neighborhood that has the highest number of new cases in the last 3 weeks per capita is York University Heights, which is the area around York University. Can you speak at all as to what is happening there? Have there been outbreaks or clusters among York University students?
So Kelly, thanks for your question. I don't have very specific information to share with you today, but I do know that we have a team that's actively looking at that. And certainly the return to campus is one feature that has been examined by the team at Toronto Public Health. So I'm happy to take that offline with you if you're interested in getting further information.
Great, thanks. If I can ask a follow-up to Mayor Tory, your colleague Joe Cressy and the Board of Health has asked that there be more transparency around specific locations, especially with workplace outbreaks. What would you like to see happen there?
I would like to see us be as transparent as possible. But I also understand, we've had many discussions about this, not in front of the media, about the concerns that Dr. de Villa and her colleagues and others have about privacy and about not stigmatizing people and neighborhoods and so on. But I would like to see us be as specific as possible. I understand the Premier has indicated his intentions to do the same with regard to workplaces. But again, there's a balancing act that we have to adhere to in these responsibilities we have, as between the public's right to know, which I believe is very, very important, and to know as much as possible, but at the same time to avoid doing damage. And so I'd like to see us be as transparent as we can possibly be, and I think we have some distance to go to get to that stage.
Okay, thank you. The final question is to Sabrina Jones from CBC News. Go ahead, Sabrina.
Hi, good afternoon. Thank you for taking my question. Mayor Tory, regarding the anti-mask protest that happened at Yonge and Dundas Square on Saturday, police say nobody was fined. Now, they say this because everyone has the lawful right to peacefully protest, but this protest goes against the province's regulations about large gatherings. So would you be able to clarify the rules then? Does that mean that anyone who protests in a large gathering can do so without facing fines?
That's certainly not the intention, and I'll ask Chief Pegg in a moment to comment on this, but the intention is that the law applies to everybody, and that while we understand that people may have protests, they should be doing so within the context of the rules. It is my understanding that actually there were people who were fined, including for violation of the quarantine rules, but in the end, people should understand two things. First, you are not going to be in a position where you can have any kind of a gathering outside of the rules without attracting the attention of the enforcement people. And I don't direct them, but I know that they're watching for these things. And secondly, I hope the rest of the people out there take note of the fact that they should disregard the advice and the representations being made by these people that are putting out propaganda that is directly against the scientific and medically accepted advice around the world about what people should and should not be doing to stop the spread of this virus. Chief?
Thank you, Mayor Tory. I guess what I'll add is to say that the protest that we witnessed on Saturday is an example of a situation that I would describe as something that is both complicated and dynamic. And as the Mayor accurately reported, our enforcement teams, certainly including Toronto Police, were active in there. But I think it's important that we all appreciate that it requires the very significant professional judgment of experienced law enforcement professionals to make the decision as to how to effectively balance public safety, in this case with public health orders surrounding masks and gatherings as examples, with that of public order and preventing situations from escalating. I think it's also important that we acknowledge and we think about the fact that it is unfortunate, in my eyes anyways, unfortunate that we find our Toronto Police and our enforcement professionals being placed in this situation where they're having to deal with that and having to make these complicated decisions. We all know the regulations, we understand the intent of them. It is all about arresting the spread of COVID-19 and maintaining public safety, and When I watch things like that happen, it puzzles me. I don't understand. I just don't understand that logic, but I'll leave that to law enforcement. I know we have the Deputy Chief of Police on the phone.
Yeah.
Deputy Demke is here, so Brad, if it's okay, I'll pass to the Deputy
Absolutely.
Chief.
Deputy Chief, anything you'd like to add to that, please?
Thank you for that. I think that really summarized things quite succinctly, and it is a balancing act between respecting people's right to lawful assembly and peaceful protest, and our role as law enforcement to ensure public safety when that's happening. And given the way events unfolded this Saturday, we adjusted our posture according to what was presented to try to strike that balance, and we'll continue to examine our options to ensure we do our part to enforce the orders while respecting people's right to peaceful protest. So I don't believe the conversation is done from our perspective, and we will continue to evolve our posture to give the proper response given the situations as they unfold.
Thank you, Deputy Chief. Any follow-ups, Sabrina?
No follow-up. Thanks so much for the response.
Okay, thank you very much for joining us, everybody. That concludes today's briefing. Please stay safe.